What would you say to people who are scared of having a bad trip with ketamine? And how should one actually prepare for a ketamine experience?
A quote unquote bad trip seldom happens, especially in the initial stages, as long as the clinic doesn't dose the patient too high right out of the bat or, initially. The way to address that is to be properly educated on the front end. In other words, I tell all our patients, you may be in the 5% or 10% who quote unquote have a bad trip, but let's define a bad trip. A bad trip with ketamine is you're scared or you're sad and tearful for a brief period of time, maybe 5 minutes. We're going to be there to reassure you and remind you that you're doing ketamine and that you're going to be back to yourself and much better once you get through the treatment. And usually what patients describe in a bad trip is they relive a past trauma, which isn't necessarily a bad thing because you're purging something negative through ketamine.